Welcome to SoulWithMindTech. In a world where seconds can save lives and information is power. What if your doctor had an assistant that never forgets, never sleeps, and learns from the wisdom of the entire world? This isn't science fiction anymore. This is the story of generative AI in healthcare. A story where machines don't just compute, they understand. Where Retrieval-Augmented Generation, RAG, and LLMs are transforming hospitals, healing systems, and humanity itself. Let's understand the basics. Let's break this down. LLMs, or large language models, are the engines behind tools like ChatGPT and Google Gemini. They are trained on massive amounts of text data, learning patterns in language, medical protocols, conversations, even human emotion. But there's a catch: LLMs can hallucinate. That means, sometimes, they guess. And in medicine, guessing is dangerous. That's where Retrieval-Augmented Generation, RAG, enters like a guardian angel. Imagine LLMs as skilled doctors with vast experience, but poor memory. RAG is their digital assistant, constantly pulling the latest research, patient records, and verified data into their hands, at the exact moment they need it. Together, they are not just intelligent, they are reliable. Let's understand the real-world use case. Across the globe, hospitals are deploying this technology in life-saving ways. In the UK, the NHS is testing My Companion, an AI assistant that answers questions like, "When is my next scan? What does this report mean? What side effects should I expect?" Behind the scenes, a Retrieval-Augmented Generation system scans through thousands of hospital records, government guidelines, and drug databases, delivering accurate, personalized answers in seconds. In the US, systems like Abridge and Dragon Ambient are transforming doctor visits. They listen as you talk to your doctor and auto-generate your entire medical summary, freeing doctors from their screens and bringing their attention back to you. Imagine a doctor who never has to look away, who never misses a detail, who can just focus on healing. Let's understand human impact. Doctors today are overwhelmed. 60% report burnout. More than 40% of their time goes into paperwork, not patients. With generative AI, hospitals are reclaiming time, energy, and focus. A simple chatbot that schedules follow-ups, explains medications, and answers basic questions can reduce emergency calls by over 30%. For patients, especially the elderly, or those in remote areas, AI becomes a bridge. A kind voice, 24/7, that listens and responds. Imagine an old grandmother in hill area, wondering if her symptoms are serious. Instead of waiting 3 weeks for a doctor, she opens an app, asks a question, and gets a safe, medically grounded answer in her language in moments. That's not just technology. That's compassion at scale. Let's understand what's behind the technology. So how does this system really work? Let's peek under the hood. A standard LLM is trained on data until a certain cutoff date. It has knowledge, but it doesn't know what's happening today. A RAG system connects the LLM to external, real-time sources like electronic health records, EHRs, clinical trial databases, medical journals, insurance policy databases, hospital SOPs. When a user asks a question, the system doesn't rely only on memory. It retrieves the most relevant, up-to-date information from trusted sources, and then the LLM generates a coherent, natural language response. This hybrid model is what makes RAG plus LLM so powerful. And now, it's being trained on multilingual, culturally aware datasets, ensuring that an Indian user in Jaipur and a researcher in Tokyo both get accurate, localized results. Let's understand the challenges and risks. Of course, every great power carries great responsibility. AI in healthcare also brings risks. Biased data can create unfair outcomes. Incorrect outputs can endanger lives. Privacy breaches can break patient trust. Over-reliance can make professionals complacent. That's why leading institutions are building human-in-the-loop systems. Doctors review every AI-generated diagnosis. AI tools are monitored constantly for bias. Data is encrypted, anonymized, and secured with multi-layer authentication. This isn't a replacement. It's an augmentation. A partnership between human intuition and machine precision. Let's understand what the future holds. The road ahead is even more transformative. AI companions that talk like humans, trained to detect early signs of depression, dementia, or PTSD just by analyzing speech patterns. Digital nurses that monitor vitals in real time and alert doctors before an emergency. Virtual care bots that handle chronic patients at home, cutting down hospital stays by 60%. Soon, even rural clinics will be able to consult AI that has the wisdom of every medical journal, every case study, and every protocol right on their phone. But there's something even deeper happening. Technology is evolving, but so are we. As humans, we are learning to trust machines. We are learning that true intelligence isn't just speed and data. It's empathy, reliability, and awareness. Generative AI is forcing us to ask, what does it mean to heal? And the answer may no longer be limited to flesh and blood. The soul of the machine. As AI awakens in the halls of our hospitals, as silicon begins to echo with the rhythm of our hearts, we stand at a new dawn, where the mind of the machine meets the soul of humanity. This is not just a tech revolution. It's a healing one. And it's just begun. Thanks for watching Soul with Mind Tech. Subscribe for more Soul Tech stories.